As the Cypress Health Region and its staff goes about the daily routine of providing healthcare services for residents of southwest Saskatchewan, a curveball has been thrown into the mix of the surgery department of the Cypress Regional Hospital in Swift Current. Dr. Ahmed, one of the surgeons at the hospital, took a personal leave of absence last fall to return to the UK, with full intentions of returning to Swift Current by February. Now, due to unforeseen circumstances, his plans have changed and will not be returning to Swift Current until mid-April. Therefore, leaving the health region with only one full-time surgeon, who also will need some time off in the near future.
He, though, is scheduled to write his Royal College certification exams, so he does need to be taking some time to, do his studying and look at that so that he's able to be successful when he writes those exams. This is a requirement for him to continue to practice in Canada, so it's important that he does this. We're trying to manage this the best that we can. What that means right now is that we don't have emergency surgical services available, but Dr. Gorey is continuing to do work through this time that he is studying, but just isn't able to do that 24-hour on-call emergency work beyond his regular practice.
And although emergency surgical care will be up in the air at the Cypress Regional Hospital in the short term, Vachon stresses that emergency situations will still be addressed in Swift Current before being diverted to outlying centres.
So our ambulances are still coming into Swift Current, and really until a physician assessment is done, we don't know whether surgery is required or not. So rather than risking sending people further, this is the first stop that people, need to make.
And as far as any surgeries which may have already been scheduled for the Cypress Regional Hospital, she indicates these will be assessed on a case-by-case basis as to whether the procedure will occur here in Swift Current or be transferred to such centres as Saskatoon or Regina. Vachon further adds the locum process is a difficult one when it comes to filling surgical positions, and therefore the health region will follow course with its current staff and the assistance of outlying hospitals until the situation is back to normal.
So it'll be another few months where we're, prior to us being back up to sort of that full complement of surgeons. And, I know the question has been asked why don't you just recruit more surgeons? We know that we have the right mix of people when everybody's in place and everything's operating as usual. Between our two general surgeons and, of course, our semi-retired surgeon that comes back at points in the year and assists with some of the work that needs to be done, and our specialists who also provide surgical services, and itinerant physicians that come in and do some surgical, we have the right mix. But, of course, again, things happen at times, and we find ourselves committed to the physicians that are working in our region, and we have to allow them that time to do what they need to do to carry on and continue working with us.
The Cypress Health Region provides healthcare services for approximately 44,000 residents in southwest Saskatchewan. Southwest TV News will continue to follow this story as it unfolds.